So I went into the Senate primarily because of my passion for healthcare and healthcare reform. I'm very concerned about the fact that in Colorado alone we'll still have 258,000 people who don't have any health insurance, much less access to health care. We have no guarantee that the plans they'll be able to buy will be affordable. One of my concerns is that the plans that will be available to Coloradans on the exchange will have high deductibles or high co-payments, and there's good research that shows that deductibles and co-payments are barriers to people getting the medical care that they need. I know that if we take care of medical conditions early, when they can be controlled, the costs overall are much less, both in terms of fiscal costs of taking care of the medical problem itself, but in terms of ability to continue to work, livelihood, and continuing to be a productive member of our society. I met working people who got sick, lost their jobs, and could no longer access health care. This helped me to realize that the people who we're talking about, the people who are vulnerable in our current health financing system, are everybody, particularly when health care and access to health insurance is tied to employment. As a physician, I actually am embarrassed that in the United States, one of the richest countries in the world, we do not guarantee access to health care as a basic right. I think it's shameful that there are lots of people making a lot of money off of health care while people are dying because they can't get any health care at all. The idea behind a cooperative is that everybody contributes and everybody benefits. And the system as a whole works to ensure the health of everybody in the system. And so all of the Coloradans who pay into the system become its members and actually would own and control the cooperative and help set the policy for how the business is operated. In Colorado, to enact any type of substantial change, we would need a vote of the people. What this bill is doing really is designing, getting information to set a blueprint for how we might redesign healthcare in our state. At this point in time, a lot of the information that you need to determine how you could design and finance a system of healthcare is proprietary information. And really you need the authority of the government to get that information, to get you what you need to design a healthcare system that would cover everybody and hopefully at the same time control costs. You know, now that we're having such hard times financially, I think we need to look at how can we do this service in a completely different way so that we can be sure that we get value for every penny that we're spending. Unfortunately, a lot of the money we spend right now in healthcare goes to things that are administrative and are not really necessary in ensuring the health of the population. Additionally, because our healthcare system primarily finances disease care, we don't invest enough in keeping people healthy and teaching them how to maintain their health so that we decrease our costs in the long run. We do need jobs in Colorado, and one of the things that keeps employers from hiring more people are the unsustainable increases in the cost of benefits that they offer to their employees. Many employees have not had raises in many years, and this contributes to their inability to purchase things and contribute to our market. I see healthcare reform as being a job stimulus plan. In addition to allowing people to choose to work in whatever format they want, not be tied to a job because of health insurance, it would also allow employees to spend a lot less on providing this coverage. People all around Colorado are seeing their insurance rates increase year after year. And if they're ill and needing to utilize that health insurance, they're noticing that every year what they're asked to pay out of pocket before the insurance even begins to pay is increasing. What I'm hoping to do is control the rise in these healthcare costs and in addition give everybody access to necessary, important preventive services without having to spend a dime out of pocket, knowing that if we can keep people healthy now, we'll be controlling our costs later. I'm hopeful that in Colorado this year we will pass legislation to begin the establishment of the health care exchange as required by federal law. The problem with the exchange is that what it guarantees people is access to health insurance, not necessarily access to health care. In addition, we know already that it's projected that 258,000 people in Colorado will still be uninsured after we enact the exchange. So I had a patient who I started to follow at about age 40, 45, and she had diabetes and worked in an office as a secretary. She did not have access to health insurance, and it was a struggle for her to come in and take care of her health. Over the years, as is often the case with diabetes, she developed high blood pressure, and unfortunately, because she could not afford to care for her diabetes or her high blood pressure, after about 5 years her kidneys failed and she ended up on dialysis. Now the irony is that as soon as she was on dialysis, she got health insurance through Medicare. And it just frustrated me to see that this woman had lost her ability to live a very healthy life, and it could have been maintained with very minimal help and assistance early on. But not until she had lost the function of her kidneys did she qualify for assistance in our current healthcare system. A lot of people are worried that I'm trying to create a government system, and I really am not. I actually am trying to create a if you want to think of it in another way, think of it as a self-insurance plan for the state where we're all part of the same insurance plan so that we can get really good rates and design how to pay for our care as efficiently and elegantly, as the governor likes to say, as possible. The one thing that people often forget is we actually don't have a lot of choice in healthcare right now. All of the choice comes to our provider and our insurer, who negotiate what providers we can see, what hospitals we can use, what services they'll cover. And once they've made that list, we can pick from that menu. In the ideal health plan, which I'd like to see developed here, you would have unlimited choice. You could see any provider. If you change jobs, you could stay with that provider. If you didn't like the provider, you could change them right away. And so I'm actually looking at increasing choice for the average person. I have some friends who are small business owners, and they tell me that it's really difficult to plan for the next year because they're not certain how much their health insurance plan will cost them. What I like about my concept around redesigning healthcare is that it would be at a set percentage of your payroll, and you could plan year after year. And if we can roll over a workers' compensation medical portion into this plan, overall for most businesses it would dramatically decrease their costs. So I see this as a big stimulus to business. If we do this right, everybody would have the opportunity to be an entrepreneur. You wouldn't have to worry about being tied to a job to be sure that you had your family protected and covered. And in addition, because everybody in Colorado was part of the system, you'd have freedom to move between jobs and to not worry about the health and safety of your family. In our ideal healthcare system, we'd let the fundamental relationship really be between the physician and the consumer or the patient, depending on if they're sick or not. Right now, there are a lot of middlemen in that determine what kind of healthcare you get and where you can get it. What we're about is having that decision be between you and your provider, and allowing you to keep that provider for your entire life if you'd like to. As a mother, a wife, and a physician, I think that access to health care is a basic human right. As a working Coloradan and a senator trying to balance our budget, I think we need to look outside the box to find ways to provide the basic safety net we need for our entire population and save money. I do hear my colleagues frequently talk on the floor of the Senate about cutting costs in healthcare, and I think that an efficient way to cut costs is to simplify things, and I'm looking to simplify things.